All right. So if you morning, if you just logged in, kindly mute. And if you got any questions, place it on the chat, and I'll be monitoring the chat periodically. And again, my name is Dr. Garais. Here's my cell phone and my email. And since we're still on quarantine protocols, this course is via Zoom at 9 a.m. on Tuesdays. And if you can't make it, and like I just stated right now, I record all of my sessions, and then I like transfer it to YouTube, and then I put the YouTube link right here in the announcements. Check your announcements, check your emails, and check this thing as well, at least twice a day, once in the morning, once at night, because there could be something important, especially around week 5 when the registration process starts again. It is in your best interest to know when things are, so on and so forth, because ignorance of the law does not preclude you to for compliance of it. I had 2 people who missed the final exam because they don't look at their emails. And once grading is in, at the end of the day, I am nothing but a secretary. I just put down what you guys performed. And now everything is on this Moodle base. So there's timestamps, so on and so forth. So good morning, welcome. If you came aboard, kindly mute. And again, this session is recorded. And if you could, just check in on the chat. Let's see if I could. All right, good. All right, all well and good. So this is MED110. So the first thing we're going to do is go over the syllabus. All right. Thank you, Mr. Antonio. Welcome. Where did I put my syllabus? Well, maybe you just click on this. Maybe you should come back. There you go. So the syllabus is everything that you need to know about the class and the format of the class. And again, like I stated, this is currently term 4. We meet on Tuesdays. Now, it is a 10-week program, and every week, all intents and purposes, every week is worth 10%. And during the course of the weeks, with the exception of week 5 and week 10, you must submit 1 task, 1 discussion, and 1 lesson in the form of case study. And I'll go over each one momentarily. And again, if it goes, there'll be two sessions, midterm and a final, written midterm and written final, which will be on campus. I have to repeat that. It will be on campus at the Alexandria campus, 4th floor, Health Lab 1. Now, because of COVID, because of the quarantine, I'm also sanctioned to provide alternative if you do not feel comfortable coming to the campus at this time. So if you do not feel comfortable coming to the campus, I need to know this week or soon. Okay, so again, here's my email. You have my phone. Please contact me. And when you contact me, please put your full name and your and what class you're referring to, because I get texts all the time. Hey, Dr. Garais, I need help, and then that's it. I don't know what you need help for, and who you are, or and what class is it in reference to. So please do me that favor, and then we will have. I'll give you alternative assignments for those days, and we also have 2 laboratories. Now, the laboratories will be on campus. Again, I must repeat myself. It'll be on campus. Now, week 5, week 10, and week 5, that is September 1. That's your midterm. I will be putting all this in announcements formally, but right now I want to get it out there so you guys can start planning your calendars. And week 10 is Tuesday, October 6th, and that will be your final written exam. Now, during weeks 6 and 7, which is September 8 and September 15, those are laboratory dates. Now, the protocols for the laboratory will also be made in announcements, but all intents and purposes, you need to reserve your slot for your because we need to know exactly who is coming to campus, when, and on what time. And the laboratory will be held at the same time as actually 10 a.m. It'll be held right after our lecture, and of course the lecture will still be made online, but the laboratory will start at 10 a.m. right after. So there's one midterm, one final, and of course, and two laboratories. Now, again, one of the alternatives for the laboratories is if you do not feel comfortable, you can come on days where we could make it like tutoring, make it like one-on-one to minimize contact with others. But again, all those protocols, I just wanted to have those dates out there right now so that you guys can start planning. This is Anatomy and Physiology 1, which is actually prerequisite, and many of you are nursing. And one class that you definitely need the skill sets for this course is your future pathology courses and also your clinical courses, because I truly believe that pathology, or logi, the study of disease, if you know what normal looks like, it's so easy to mess with normal and figure out abnormal. Which if you look at the word abnormal, it means al, pertaining to, ab, away from the norm, which is the rule. We'll be going over homeostatic mechanisms, or homeostasis, right? How your body deals with imbalance. And every second of your life, it's constantly dealing with imbalance. We're going to be talking about a little bit of some chemistry, but I'm trying to keep away from a lot of more complex chemistry for obvious reasons. Let me see if there's any questions. Those of us who have young kids and we have to come to campus for labs, again, like I stated, there are alternatives. If you feel that that you have high risk patients at home, and if you guys have know anything about COVID, I'm more talking about like, for example, my mother-in-law is 81. She lives with me, and she is now COVID positive because of my exposure, right? Because there is a process. It's called email. You email, and once you have the official dates and the announcements are there, you follow the instructions. You email me and say, yes, I'm coming. It's like a RSVP, so that the campus knows exactly how many people. And also the future announcements will also entail what you're going to be doing. If you have scrubs or a lab coat, you should wear one. Masks and all of that. We're going to go through all of those protocols in those future announcements, right? Now, student ID, many of you, since we don't have on-the-ground personnel, don't worry about student IDs right now. We have such a small campus. We know exactly who's on campus. And the doors, there'll be somebody on the front as well. We're more concerned about the CDC social distancing protocols, and also essentially I treat the laboratory like, if those of you who already work in the business, I treat it like NICU, where we have to scrub in and scrub out, just like the high risk departments in the hospital. Nothing really has changed. Now, with respect to what you guys believe is high risk, if you look at the data, and again, there's a lot of garbage floating around COVID, especially from our lovely CDC and our lovely Department of Health. A lot of inconsistencies in protocol, but do know and understand that you're in healthcare. You're going to be at risk for the rest of your career. And if it's not COVID, it's going to be something else. And it is what it is. But again, you follow the protocols and social distancing, glove up, mask up, you should be fine. Half my family's in healthcare, and I'm from New York City. So And I have several family members who are COVID positive. But what happened, right? They all got better because because in healthcare, you follow the rules. The odds of you getting better are enhanced. But again, it is a personal preference. I have 6 children myself. If I was working in the field, I probably would not be at home. I'd probably be in the residence room at the hospital. I'd probably stay there the majority of the time. My own brother-in-law who used to live with me ever since of COVID, he now lives with his girlfriend because I have high-risk family members. We do what we can. So if you feel uncomfortable, that's okay. I can have alternative assignments and alternative things that you can do to earn your credit. And also the laboratories are nice because you get to do actual things with your hands. If you guys know anything about the different types of learning, you could listen to me all day. Some of it will go inside your head, some of it won't. But when you do something and actually you actually cut into something like when we go over the digestive system and urinary tract systems, we cut into a pig and then we cut into actual hearts, and we're actually playing with it, cutting into it, slicing and dicing. It sticks in your head a lot better than it would for me showing you a picture or watching a video. But again, because of the quarantine, because of all the things that are going on, we got to do what we got to do. All right. And tutoring is free. Please shoot me an email for any class that you have trouble with, because I'm kind of like the hub on the Alexandria campus of people who request for tutoring. You can request for tutoring via axtutoring.com, or like I said, just shoot me an email. And also, I have a master's degree in physical chemistry, which is part mathematics degree, and I taught math for years before I came to Stratford. So I can help you out in math, which is actually the biggest pet peeve in the School of Nursing. They're having some serious issues with their pharmacology class and for calculation of meds. And the math isn't that complicated. It's just that there's just different ways of looking at it. And I could help you with that regarding tutoring. So get tutoring often, get tutoring early. Don't try to come to your professor for tutoring like week 9, because then 90% of your grade's already done. Come when it's early, week 1, week 2, and start that tradition, start that process. And again, Mr. Antonio, thank you, sir. If that is exactly what college is for, it's to actually work on your, whatever deficiencies you have. And I'll be honest, when I first started college, I didn't know my times tables. And I always tell this story. People usually are in remedial math for a couple of weeks, and then they get to go on to a normal math class. I was in remedial math for a year in college. And then, thank you, Miss Bass. And Miss Bass will attest to some of my techniques. They're very simple and they're very straightforward. And if you see, like, it's like wash, rinse, and repeat. If you see somebody do something on, and I also, pharmacology, I'm a chemist. And also I'm internal medicine. So if I don't know my pharmacology by now, it'd be a sad state of affairs. If you look at things like in a more simplistic way, when you look at anything that's really complex, it's just a problem that's in parts. So if you figure out all the little parts, all the little problems, the bigger problem should go away. So now to get back on track, every week there's a discussion, there's a task, and a lesson in the form of a case study that's due. Okay, so everything from week 1, this week, is due next week, and next week is Tuesday, August 11. Now, the late protocols state that for every day that you submit it late, we chop off 10%. But honestly, we're in healthcare. There's something called the golden 5 minutes. For those of you who did CPR back in the day, it's the reason why most medical professionals have a thing about time, because the the golden 5 minutes states that if there's any cardiovascular or any respiratory arrest for greater than 5 minutes, your patient will have irreversible brain damage. Just 5 minutes, irreversible brain damage. Think about that, right? So if so being late should not be part of your medical vocabulary, and medical professionals have a thing about it. Um, so if you look at every week, it's like task, lessons, labs, and discussion. So if you keep up your task, lessons, and the laboratory is part of the lessons, and your discussions every week, you should ace this class. And you kind of know the grade, because you know if you did any one of those three things or all of those three things during the week. And also, just like your syllabus, just like your your Moodle shell, it outlines everything that you need to do during the week. Now, you see how there's like all these activities. Again, it is in your best interest to either attend my lecture or watch my lecture, because not all of them are due, and also some of them are required during the laboratory. And like, for example, respiratory physiology, since we're not on the ground, we don't do a spirometry lab anymore. And even if we did, because of COVID, we can't do one, because COVID has a very, very large disposition for lung tissue. So having us all breathe into a tube is not a good idea. And week 9 is really neat, because I introduce you to the wonderful world of blood gases, which, by the way, that particular exam and chapter is a big F grade in pathology. A lot of nurse candidates do not do well in ABGs. It's also one of those high value topics for NCLEX. Now, the discussions, APA style mandatory, yes. And if you struggle with that, again, I can show you. There's a video that I put out that I show you like the easy, fast way how to do APA format. And also, another person you could talk to is Ms. Zoe Page, Z Page at stratford.edu. She is our librarian, and she does also Zoom sessions as well. Because remember, all of these things that you need to do, and I'll show you why APA format is important, and also why your discussions are important. Many students feel like, oh, some of the things I do here is busy work. It may seem like busy work, but if any of you ever watched a Kung Fu movie or like the Karate Kid, at first the Karate Kid's like, hey, why the hell are you making me wash your car? Taking advantage of me. No, I'm developing a skill set. You don't know it yet, but I am. Like a classic example. Let's jump right in and let's look at, well, this week's task is easy. You just have to sign the what do you call it? There's some sort of form or something. Don't do the microscope stuff, because we'll be doing that in lab. And even though I think this may or may not work, but the website for the laboratory stuff is I don't know, it's janky at best, if that's a word. It's glitchy. Now, here's your lab safety contract, and you just download it and sign it, or you could scan it or take a picture with your phone, because legally we need all students to make sure and understand they realize that when we're in laboratory, there are things in there that they're not dangerous, but it has a potential danger. For example, you work with some certain chemicals, and for us, it's dissection. So you're working with things that could poke you, right? Or could cut you, like a scalpel or a probe or some scissors. And that's the function of the laboratory safety contract. And by law and by OSHA standards, I have to have on record all in the class, even if you're not coming to lab, to acknowledge that form. Now, let's look at this discussions, and to piggyback off of the question by Ms. Hall regarding APA format. And some of you, good on you, you already started, and I already got, always read your comments, because that's where we really learn. Now, if I write like, hey, everything's cool, Thank you very much. You will receive full credit. That means you did exactly what is asked for. Now, how to do your discussions. Discussions are at least 200 words and should be have a distinct beginning, middle, and end, like an introduction, a body, and a conclusion. Now, the body should have evidence supporting whatever you want to say. So, for example, electron microscope allows for a better visualization of pathogens. First of all, you have to define where the pathogen is. You have to define electron microscope versus, what's a normal light microscope. So that's already in your introduction, and you got it from somewhere. So you really should, what do you call that? You really should cite it, and there's a format for it. And you could use things like Purdue OWL and bibme.org, which is in my video. And I'll put my video in the announcements later on today. I made a homemade video. So this is the skill set that we're trying to build. When you're in work, there's many times where you're going to say something in a meeting, or you're going to reply to an email or a memo, and someone's going to say, well, I don't believe you. Or you're going to try to convince somebody to do something. Here's a classic example. Many times they tell me, Dr. Garais, since you don't have that many students compared to other programs, we simply don't have the budget for what you're requesting. So I have an introduction, just like this discussion. In my introduction, I state that it is my opinion that we do have budget, and the rationale on why. This is the following reasons. And then the kicker, I have evidence in proper academic APA format. APA stands for American Psychological Association, and they're one of the many formats. There's actually 4 or 5 formats, but it's like the simplest format to show where did you get your source. And 9 times out of 10, when I write a memo, when I write a request, I get what I want. And that's including raises, that's including budget. And I get what I want, not because I'm mean or aggressive. I get because I have something that's organized, easy to read, and that has a distinct beginning, middle, and end. All right. And it has an introduction. The body has evidence. And you will learn this word, evidence-based medicine. We as clinicians cannot say anything to anyone unless it's properly documented. Did you guys ever wonder why your physician can't tell you the diagnosis? It's not that they don't know. They know, they have an idea, but is there documentation? Is there something to back them up, right? And that's when I have to wait and get the test, right? And you'll learn that in your laboratory classes, what kind of tests, right? And that's the reason why the doctor really can't say anything to you, because they're not in a state or condition of complete or thorough knowledge, which is the actual true definition of a diagnosis. And in order to do that, they have to have evidence. So when you're talking about the electron microscope and you're defining it, is there evidence that it actually views pathogens? Is there evidence that is good for diagnosis, right? Right off the bat. First of all, right off the bat, electron microscope is about, I don't know, it's really ridiculously expensive versus a light microscope, which barely costs $200. So you can find your sources and talk about that. You could also talk about, is it practical, right? Because do I really need to see at the level of electron microscope to see if you have an STD or not? No, I need a light microscope and a swab, and I could tell you exactly what it is, right? So, but do you have evidence, right? And supply that evidence. So later after class, I'm going to be putting the video on APA format and how to do it. And another thing also, your discussions should be in your own words. I know you're getting it from a source. You're going to be tempted to copy and paste it and change it up a little bit. How's this? Change it up a lot, because other professors use this program called Turnitin. If it's greater than 25% match, it'll be considered plagiarism. And if you do it more than once, especially after you've been warned, your professor has the right to fail you for the course. And then on top of that, they inform your advisor, they inform the campus president, and they inform this academic committee, and that's no bueno. You don't want to be a part of that. And I'm on the committee. The majority of the time, the student didn't mean to do it. The student just was, copying and pasting and didn't change enough. Now, the best way to do it, I also have another video that I always use on YouTube is how, and you could look it up on YouTube, how to paraphrase to avoid plagiarism. And my way is I take the whole entire article and then I read it and then I just make notes, my own handwritten notes. And then in my own words, I put down what I believe the article meant. And then, of course, then I refer back to the article. All right. So if you're not good at that, or if you're not good at writing, again, you can call upon me for tutoring. And another person is Ms. Zoe Page, our librarian. She can help you out as well. And regarding writing, I am published. And and actually, that's actually how I got into college. It definitely wasn't my math skills. But what did I do when I was in college? I fixed what I needed to fix. I'm not an awesome mathematician, but I fixed it enough to go to graduate school and to get my master's degree in physical chemistry, which, by the way, master's degree in physical chemistry is, when they say that term, that's not rocket science. Physical chemistry is rocket science. I'm the guy who figures out the fuel that goes inside the jets or the rocket. But then I fell in love with a medical science, because medical science is really neat. And it's also the reason why, I hope, is the reason why you guys got into this business, because it's just really neat if you see somebody who's sick and then you did your protocol, you did your part along with your team, and they got better. It's a really neat thing, and it's a really great feeling. And my professional opinion, there's no other job in the world where every day you get to do battle like that, and at least you get to do something. There's not a lot of jobs in this world that can really say that you're contributing to the overall good of society. Now, let's look at the lesson. The lesson for the day, I had to signal my son to get out. Now, the lesson of the day, you could try this virtual microscope. Sometimes it works, sometimes it doesn't. Definitely watch this video. I'm going to have some notes on it, and I'm going to share these notes. And I also have these notes where I got better pictures than the video itself. And we'll be doing and don't complete the microscopy lab, because we're going to be doing that when we're in the actual lab. But if you can't show up to lab and you call me, you'll be doing this via online. Now, how do you get credit for lesson 1 for this week? Well, you look at the application assignment, you click on it, and then there's a case. Now, case studies are neat because it's a way where you can play doctor or play nurse and play what if with something that actually happened. And this is apropos to what's going on right now. So they're talking about fatal flu. They're probably talking about SARS, which, by the way, COVID is a variant of the old SARS. Well, it's not that old, but so there's this worksheet here, and then you click on that, and then it's going to ask you some questions, and the data that's here that you need to fill out, you get that data from clicking on this and moving down, the whole thing. So my advice is, the first thing you should do is you click on that worksheet and print it out if you can, or put it in another window on its side, and then read through the entire case and then fill in the answers where you can on the worksheet. Actually, on some of the parts of the worksheet, right, they're just asking you questions that could be derived from just reading the case itself. And worst comes to worst, you Google the answer. But again, this is due next week. And please, full sentences, because it is college, right? And if you're having trouble with this, give me a call. I've done tutoring sessions on this because this is kind of weird the way they do it, but I could walk you through it as well. So that's due, of course, all of that due is next week. So the task, that's easy. You just fill in the lab form. Discussion, right? Now you know how to do discussions. And then last but not least, hand in this worksheet or the answers to the worksheet called Fatal Flu by next week. Now, let's see. Is there anything else I have to talk about before we jump right in to this video and this video as well? Let's see. Oh yeah, look up parts of the microscope to prep you for your future laboratory. Know the parts of the microscope. You'll be responsible for that. And and light microscope, you can look that up anywhere. Yeah, the worksheet I believe is a PDF, so that's why I said like print it out. But if you have the program to switch some people with Microsoft Word have the ability to switch PDF to Microsoft Word. But yes, please, yeah, you could submit it in Microsoft Word so it's easier to look at. And if you do submit it, when you save your document, let's say for example, let's actually do it and show you it right now. Let's say for example, right, I'm doing this, right? And then I have my worksheet here. Okay, now my worksheet, you can see here, it's in the form of a PDF, but can I just take this stuff and, right, do one of these jobbies? Take this, I copy it, I open up Microsoft Word, I could paste it, okay? If it works, yeah. Now, here up in the header, and of course, and you might have to, yeah, there's some formatting issues here. You might have to, but let's say, for example, I want to turn this in, right? You could double click right here on the top on the header, and of course it puts your name. So I'm going to put like student name, date, right? Professor name. Also course is MED110, 5DAX, right? And it automatically puts your name. And then if I save it, right? Let's say I'm going to save it, right? I'm going to put my student name, the course, right? And then the date. And what's today's date? What, the 4th? 0804 2020. So that when you do send it to me, I know it's you. I know what classes it's for, right? Just, you know, just in case it might get lost in the shuffle. And if it's not going inside Moodle, because sometimes Moodle is a pain, right? If it doesn't go in Moodle, let me get back to the course. If it doesn't go into Moodle, again, you have my email. Just email me and say, hey, Dr. Garais, there's something wrong with my Moodle. Here's my submission for the week. And that's another way to get beyond it. So let's now jump in to the actual lesson. And let's look at why is microscopy important to us? Why do we care? This is supposed to be anatomy. I'm supposed to be looking at big parts. Well, before we look at the big parts, let's look at this this picture first. Regarding the organization of life, and where's my favorite picture? If not, I'll just pick one. Let's just pick this one. So when you're looking at Remember, this is anatomy and physiology. Anatomy means tomi, to cut, ana, into parts. Physiology is logi, study of, physio, which is how the parts work together. And pathology, we learn like as a matter of fact, because if you know normal, you could figure out abnormal. And pathology is logi, study of patho, and patho is disease. So if you look at cells, and before we can even get to cells, you look at molecules and atoms and all that, and I believe that's next week's lecture. The cell is the not the smallest unit, but before the smallest unit is molecules and atoms. But atoms and molecules, atoms make molecules, molecules then make cells, cells make tissues, tissues then make the entire organ, and then the organs are grouped together into systems, and then you have the person as a whole. When the person gets sick, there is a pathway, hence the term pathophysiology, right? There is a process to disease. Now, the one thing that that you need to learn is that we are not gods or goddesses. We don't decide who lives or dies. That's TV. We just know that there's a pathway that when something gets messed up, it follows these arrows. So when my patient has multisystemic organ failure, that didn't just happen today. Something happened before, right? Now it could be acute, meaning it happened maybe over the weekend or within the last 6 hours, but there's definitely a path from normal to abnormal, right? You don't just get cancer all of a sudden. There's a process to get cancer, and you'll learn that in pathology. And one of those processes is the cell has to be abnormal. Then the cell, and one of the things about cancer is the cell, typically when a cell gets too many, or when its genetics tell the cell to stop, the cell will stop growing. But in cancer, it doesn't stop. It just keeps on growing. And if too many cells are being made, it'll eat up resources of my patient, right? That's why my patient loses a decent amount of weight, and that's called cachexia or wasting syndrome. And then, of course, that cancerous cell will multiply, then affect the tissues, then it will affect one organ. And if it's a malignant tumor, it'll travel. Then you'll get metastasis. Then you'll have multi-system organ failure or organ problems. And what will happen to my organism? They'll die. So, knowing your anatomy and physiology, knowing the pathway is the smart thing to do. So here's a classic example. Ladies, I hope you take and get your pap smear on a regular basis. If we see the abnormal cells early, what can we do? We can deal with those abnormal cells before it starts invading into tissues, invading into the organ. And in the case of your pap smear, your cervix, which is the cervical tissue around, which is the neck of your uterus. So it doesn't affect the uterus. So the uterus doesn't affect the other organ systems, and then you don't get metastasis. So you won't have cervical cancer, and you won't succumb to it. And we deal with that when? Earlier. Like I mentioned, I'm an internist. My specialty when I was practicing was internal medicine. So we're always big on prevention. Because when you already have a heart attack, there's not much I could do for you. When you already have lung cancer, there's not much I could do for you. You already have it. And we're going to be talking about the implications of anatomy and physiology on exercise, on diet, because many of the fad diets are based on bunk science. That's why they don't work. But many of the strategies that we have to help patients lose weight and to get better and to feel better are based on anatomy and physiology. So you can now see the rationale or the reasoning why we look at cells, why we look at tissues, even before we even look at organs. And next week or the week after, we're going to be looking at things like DNA, RNA, molecules. That's even smaller than the cell. And which, by the way, that's why viruses are very scary. If you're wondering about the mask debate, well, there's other reasons why you wear the mask, but it's not to protect you against that virus. Here's your typical size of your cell, right? See that really dark part that's right inside the cell? That's your nucleolus. A virus, a typical virus, especially coronavirus, is small enough to get through everything and to go inside there. And the thing about viruses is they can make their own DNA and they can copy yours. They use your DNA and use your RNA to do what it wants it to do, which is to make more virus. And that's why the virus is so insidious and so dangerous. And we're going to be talking a little bit more about viruses later in the term. So when you're wearing that mask, it's to do other things. And we're going to be talking about why we wear masks in the laboratory and why we wear masks in the hospital. But it's not to protect you against that virus. The virus will go through your clothes, through everything. But remember, if my patient is immunocompromised, meaning to say is they're exposed to other things, because right now I'm in my son's bedroom. It's relatively clean, as much as a 14-year-old bedroom can get clean. But there's at least 200, 250 things that could kill me in this room. But why do I not die? Because all of this is intact. And one of the organ systems we're going to be talking about is our skin, and how it's crucial to the immune system process. And I'm not big on surgery because if I open up my skin, what will happen? Now I expose all of this to what? The 250 things that could kill me that's on the outside. And that's why emergency rooms, NICU, cardiac care unit, that's why we try to be as sterile as possible when we're in these specific rooms. And we're going to try to emulate that. Not try, we will emulate that if you come into for laboratory. So that's the reason why we're going to look at cells. So let's look at some classic cells, and it's kind of like a little introduction to your biochemistry and your microbiology class. So let's look at this video. It's located in lesson 1, and I'm just going to go through pieces of it just to give you an idea. Now, let's all be honest. Videos, even if you're semi-interested in it, and we are semi-interested in this, videos are boring, right? Especially education videos. And also your textbook as well is boring. If those of you who have any issues with sleeping, I used to have to take sleeping pills every once in a while. I'm a very neurotic personality and I don't sleep very much. You know how I get to sleep? I pick up one of my internal medicine textbooks. I try reading it and you'll be out like a light. Same thing with your videos. So how do you tackle these videos? And how do you tackle textbooks? Well, first of all, don't read them cover to cover. You're asking for trouble. You're just going to fall asleep. And you have to develop this skill set called active listening. So hopefully when you're listening to my lecture, you're like, that's not important, that's not important, that's not important. When you hear a key word or something that's important, what should you do? Oh, immediately write that down, okay? And that's active listening, because not every little thing you're gonna need. So I'm gonna pretend to be you, the student, and then I'm gonna go over a little bit of this video, and then I'm gonna be writing notes, and the notes I'm gonna put and I'm gonna share with you in the announcements. So let's start this video and let's see how we do.
Hello and welcome to Anatomy and Physiology at Glen Oaks Community College. I'm Dr. Ren Hartung. For this video, we're going to look at histology for at least the majority of the tissues of the human body. What I want you to key in on when you're looking at histology, in terms of making it as simple as possible, what you're looking for when you're presented with a histological image like this one is that you want to look for the major features that you can make out and use that information to determine what type of tissue it is. So when you're doing histology, start learning those major features of the tissue. Where this is important is if you see this tissue prepared a different way with different staining techniques, etc., then you should still be able to recognize the particular tissue that it is. And if you get a slice that's from a different part of the body that might look a little bit different, as long as you're looking for those major features, you should still be able to figure out what the tissue is. This slide is adipose tissue.
Okay, let's stop. So right off of there, the majority of part of that, about half of it, I checked out. Nah, not important, not important, not important. But what I got was histology. Okay, that's important. So logi, study of, histo is tissues. And this particular tissue, right, the whole thing, right, is a tissue because it's a confluence of cells. And the cell itself, like this is like one cell, there's another cell, there's another cell. That's cytology. And what the good doctor said is, look at your major features. And do you notice what he didn't say? Did he say memorize the color or the stain? No, he didn't. That's actually one of the biggest mistakes in microbiology and in histology class and pathology class. Everyone tries to memorize what stain it is, what part of the body it is. The best thing to do is you look at a slide like this one, and he already said this is adipose tissue, so it's fat. What are its major features? So right off the bat, if we're not looking at this in color, one of the major features is what? It's bubbly. It's got a lot of spaces. That's what we noticed. And then you will also notice that the histology or the anatomy also matches up with physiology, its function. So fat tissue is not only fat and spongy, and you could see that it's filled with spaces. Inside of these spaces is the storage for glucose, and that is the actual major function of fat. And that's why you get, when you get obese and eat too much, that means your body just keeps on storing fat. So what should you do to reduce these spaces, to reduce the number of fat, is to do what? You got to decrease your intake. You have to stop storing away fat. And the other thing we could do is, what do we use glucose for? Glucose is sugar. We use it as a fuel. So you got to work out. So you have to actually do some exercise. And I'm always telling my patients, it doesn't necessarily mean you got to join the gym, but you got to do something. You got to do some activity. And I ballooned up like an extra 30 pounds during this quarantine until I got back into the swing of things. Because it causes a lot of health damage. And remember, we talked about homeostasis. Everything should be in the middle. Everything should be, what do you call that? In stasis, somewhere in the middle. It should be in balance. So there, you shouldn't have no fat, but you should have some fat. Okay. So when we look at this, we can easily recognize this as fat tissue because it's bubbly, it's got globules, right? And there's a lot of spaces. So let's say if I used a different stain, like I believe carbofuscin is like the color brown. Even though if this was brown, you could still recognize it as a fat cell.
And I can tell it's adipose tissue because the major feature of adipose tissue are these large, kind of roundish white areas. These are the actual adipocytes or fat cells that we see in adipose tissue. There's some other structures here. This looks like a big blood vessel to me, but don't let that throw you off. And there's these darker staining connective tissues. But the majority of what we see here are these big white open cells, the adipocytes. So this is adipose tissue. Let's move on to the next slide. This is also adipose tissue. Again, we have these big whitish open areas. These are the cells, the adipose.
You can also see here, it's a different view, but it still has that bubbly appearance. And this is even a magnified view where we could see the nuclei. Now, typically, if you remember, like you look at a cell, the nuclei would be like, you know, in the middle here somewhere, there'd be like a darker thing. But on fat cells, it's on the side because we now know what's in the middle. Glucose. So the DNA and RNA, and the DNA is the blueprint of what the cell is and what you are, who you are. We're going to be talking about that in the upcoming lectures. It's all here on the sides of the cell, not in the middle.
And this slide is showing us something else about adipose tissue, and that is that the adipocytes, the fat cells, have nuclei, of course, but the nuclei are found on the periphery of the cells. They're on the edges. So that's another major feature, these large, open, white cells with their nuclei on the periphery of the cell. These are adipocytes, and the tissue, of course, is adipose tissue. Next slide, basically the exact same picture.
Okay. I think we all get how we can view this video and how you can take it apart. And I'm going to have notes and other pictures that match up to it. So during the week,
I just darkened the color a little bit more so you could see it.
So that's how you go through videos. Okay. Now, for future reference, starting next week, there'll be for your task, you're going to have to submit something called a concept map. Now, you could look it up like you Google anything, right? What is a concept map? Now, if you look at concept map, you see how you have your main idea, and then you have these branching ideas. Like for us, the main idea was histology. And then the branching idea would be like, how do I figure out major features? And then another branching idea was, what are the major features of adipocytes? And then this other branch would be another cell. And this another branch would be another cell. Do you see how it goes? It kind of maps out what's important and what isn't important, right? Because the further along on the periphery would be what? Something that's more specific. Now, you can also do this on Microsoft Word, but there are also programs that you can Google that can help you make this. Now in Microsoft Word, let me get my Microsoft Word out. You just look up like draw, and you could, you just freehand it as well, or you can insert shapes, insert and then go to shapes, and then you could like do like this, and then insert, and then shapes. I can find an arrow, and put an arrow, and you could do things like that. And then you can put text in it, so you can insert like a text box, something like this. And again, I'm going pretty fast on this. Or you could click inside the here and then start typing away. And if you need help on that, give me a call, and then we could do a quick Zoom session and how we could share the screen so I can show you on your Microsoft Word how exactly you do that. But the other people, you can also just take a blank piece of paper, right, and just draw, and draw it neatly with a ruler, and then of course take a picture of it or scan it, and then you could submit that, make your life easier. But that's for future reference. That's for next week. But that's what this concept map means. And it's just a different way to write notes. All right, so we went over discussion, what needs to be done, how to look at and watch this video on your own. And I'm gonna provide you with extra pictures and also extra notes based on this video. So my advice is watch the video, try to make your own notes, and then compare it to mine. Because again, yet another skill set to develop, how to deal with boring videos and how to break them down so that you can extract the information that you need for the exam. And how do you know what you want and need for the exam? Well, we know this is an anatomy and physiology class. So if it has to deal with parts or how the parts work together, then that's something that's important. And of course, watch the chain of infection video, because that's very, very important to what's going on nowadays. If you recall, in the beginning days of like in February, March, they were talking about how COVID was just what do you call that? Was direct contact. Now they're saying that it's also aerosol or airborne. So if you know your chain of infection, remember we talked about healthcare? look at a diagram of a chain of infection. If you know how a pathogen, of course, which is anything that can generate, or create disease, right? If you know the pathway, right? Who's the reservoir? What's the portal exit? How is it transmitted? You can do what? You can block it, okay? And that's actually what we're doing. So, for example, you have diagnostic techniques to figure out who has antibodies that actually has the pathogen. We know that a portal of exit is what? If you breathe or you cough, hence the mask, right? We know it's also means of transmission is also direct contact. That's why we're wiping everything down. We try to wear gloves when we can, and we try not to shake anybody's hands, right? The portal of entry, of course, is either skin or airborne. Again, the mask. Again, gloves, and the host should be susceptible. Now, when we look at it, someone was mentioning children. We're not too worried about kids getting it. That's not why Fairfax County and all the other public schools are opting for full online for the fall. They're worried about that the child will do what? The child is not immunocompromised. So the child will carry this pathogen to who? And it'll act as a reservoir. They'll carry it to someone who is susceptible. And who's susceptible? The parents, somebody older, or if the child has some sort of immune suppression. For example, I have a neighbor. Unfortunately, his daughter got diagnosed recently with lymphoma, which is a cancer. She really should not go back to school ever because she's now immunocompromised. And if she gets sick by one of the other kids, it will exacerbate her cancer and it'll put her in danger. That's what we're more worried about. We're more worried about this chain of infection growing and hitting our most vulnerable population. And if you look at the CDC and other things, the numbers are what? Staggering. It's 82 to 87% geriatric. People who are greater than 65 years of age, and all of them have some sort of history of cardiovascular or respiratory problems. And just on a little side note, I do not believe in the diagnostic criteria because guess what? I dare anybody to look it up. Is there any diagnostic criteria for COVID? They have every symptom underneath the sun. From can't feel my tongue.
Yes, honey.
Hello, can you kindly mute, please? Thank you. Right. So that's something that you, as a medical professional, should be wondering. Why don't they have any clear-cut diagnostic criteria? That's number one. Number two, what are the kits made out of? I have a lot of colleagues in internal medicine and infectious medicine who are very upset that we don't know what's in the kits. Because of course they're proprietary. No one wants to know, no one wants to tell anybody what's in the kits because that's money and someone could copy it, right? So how do you know the kits work? If I don't know how something works, how do I know that it works? And last but not least, because if I haven't scared you enough already, another thing that the hospitals are doing, which really is concerning me, they test the patient. Let's say, for example, you come in for congestive heart failure. You have CHF, right? They deal with you, right? And they're taking care of your congestive heart failure, right? They're taking care of your lungs. They're taking care of your heart. Well, when the patient goes south and is not doing well for a multitude of reasons, they test for COVID. If the patient's COVID positive and then the patient dies, guess what they label the patient as? COVID patient. No, the patient died because of CHF. The patient didn't die because of COVID. The patient died because of CHF. But you could see how it pads the number, and it's very scary. And I had a good friend of mine die recently because he needed his dialysis, but he's a high-risk patient, right? They reduced the number of times of his dialysis because they didn't want him to expose to COVID. But does that help somebody who has only half a kidney? No. So he eventually died of what? Kidney failure, right? So you see how understanding how this really works and understanding anatomy and physiology and also understanding what we really do in the hospital is very important. And unfortunately, right, because of misinformation, a combination of misinformation, politics, and really poor finance, we got a lot of trouble. And it's infecting more people than it should. Actually, it's infecting far less people than it should. If you guys looked at the data that was out in March, what they say, they said by August it would kill 4 million people. Don't get me started. So, knowing that, now you could see the practical applications, right? You know, sans my views on what's going on, right? You could see the direct practical applications of the class that you're currently in. So I'm not one of those professors who are like big on grades. As long as you have the minimal, you're enough to pass, enough to get you to where you need to go. What's more important is, did you pick up the concepts and did you learn them for future reference for when you're out there and you have to explain these things to your patient who does not have your training, right? You guys know, you guys been in the hospital. How many of these doctors that you talk to, and you talk to them and you still don't know what they're saying? They have these lovely MD PhDs, right? But are they helping you? Right? And it's part of it goes, and part of knowing basically on what you're studying is just as important, and how to communicate that to your patient, whether it's in writing, like in discussions, or verbally, like what we eventually you'll do in your oral communications class, or what's the other class that you have to do a lot of presentations? I believe it's well, your clinical classes as well. You have to do presentations, but you could see how knowing and understanding chain of infection, histology, how pathophysiology can help you be a better clinician and help you understand what's really going on. Does anyone have any questions on what's due for next week and how to do it? And again, if you're still a little bit lost, hang on, and I could re-explain. Since I'm going relatively fast, I could re-explain it now. You could still stay on, but if you're good, kindly log out. I believe I was able to record and get everybody who is on the call today. All right. With that being said, thank you very much. Nobody has any comments? Nothing?
Well, I kind of do.